By the name of Allah, the most gracious, the most merciful. Dear second year ISP students, I am Youcef, your medical English teacher. Hi again in another course. So, last time we have seen the English language tree and its different uses, and we have started from the generals, moving to our objective, which was the English for medical studies, or the English for medical purposes. Today we are going to shed the light to another field, or we will change the scope a little bit to learning health and care main vocabulary. To start, we have first to learn useful health and healthcare vocabulary in English, including common diseases, medical supplies and equipment, medicine names and other useful vocabulary words used at hospitals. The second point is talking about your health is extremely important when speaking any language and so when learning English. This should be one of your key focus points. This is important because if you ever found yourself to be ill whilst in an English-speaking country, you would be much more easily able to explain what the problem was. So the point here is not just about learning English for your work or your profession. So the point is when you are in another country or abroad, inshallah one day, and you fell ill, you will be able easily to contact or to communicate with nurses or doctors there. The third point, which is very important in day-to-day conversation, for example, explaining how you are when someone asks or talking about current issues surrounding health. So, here is a list of some famous diseases which are going to see today. So, starting with runny nose, broken bone, bruise, sunburn, chills, backache, nausea, dizziness, flu, stomach ache, fever, snake bite, and cough. Here is a picture to show or to explain more the previous list. The runny nose is absolutely clear. The broken bone is when you fell down and broke your bones. The bruise is when you have an injury but you are not broken your leg, which means that there is a discolorful part in your skin, a blue or a purple one, but it is not a type of a broke. So, moving to the sunburn and chills. Chills is an unpleasant feeling of cold. When you see some of our mothers or fathers in the days of winter always keep telling us that they are feeling cold. Moving to the backache and nausea. Nausea is the feeling of your stomach full and the want of vomiting. Dizziness is when you get, for example, to the games park and enter to any type of games which goes through high levels and you feel dizzy. Flu, stomach ache are very clear, and also fever. Snake bite is when you feel a bite from a snake, and a cough finally. So, common illnesses and common treatments. We have here common illnesses: fever, high blood pressures, broken arm, injury, diabetes, sore finger. It is also, we can say, a bruise, as we have mentioned before, toothache, stomach ache, or sprain. And here is a list of common treatments. We have to take a bed rest or a blood test. Diets maybe for diabetic people. Surgery maybe when the situation is more dangerous. Exercise, physical therapy, shoot, jab or injection, like we say. Massage, X-ray, an eye exam, pressure measuring or examination. So, here is a picture also explaining more and more the illnesses and the common treatments. As you see, the high blood pressure, the broken arm, fever, diabetes, sore finger, toothache, stomach ache, and the sprain. The treatments or the common treatments are bed rest, blood test, diet, injection, as I have mentioned before, physical therapy, exercise, or surgery. We can also have a massage or an X-ray test or an eye exam, infusion examination or pressure measuring. So, here we will move to another part of our lesson, which is types of doctors. We have first a surgeon. A surgeon is a person who is doing the surgery or the operation. Paramedic is in our case, which are paramedical students or paramedical nurses. Psychologist is the doctor responsible on the psychological part, sorry. A nurse is like a little bit like the paramedic. The ENT doctor stands for ears and nose and throat, which is in our language ORL. Pharmacist is very clear. Consulting doctor and attending doctor, the difference between them is only in the consulting doctor only gives advices and write medicine, while the attending doctor is the one who is responsible of taking care of the patient. The duty doctor is also called الطبيب المحلف, and the family doctor, veterinarian and dentist are very clear. So here is the picture which shows you more details about what we have been saying for a while. Surgeon, paramedic, psychologist, nurse, ENT doctor, pharmacist, consulting doctor, attending doctor, and duty doctor, family doctor, veterinarian, and dentist. So for more tools and medicines, you can check the video below in the link. I will again later post it in the page, inshallah. So here are some medicine names, which are Orange, cough syrup, antiseptic, lotion, decongestant spray, soft gel, blood, ointment, lozenges, powder, eye drops, effervescent tablet, toothpaste, aspirin, caplet, and capsule. So here we are going to explain these types of medicines. So the solution is the normal or the gel. The oral orange is an oral liquid that may help our nasal cavity. The cough syrup is when you have a cough and you take it. Antiseptic and lotion. Decongestant spray is a liquid also helping to ease the nasal spray and its cavity. The soft gel and the blood bag. The ointment, lozenges, powders, and eye drop are very clear. If for the effervescent tablet are tablets which are or sparkling tablets. In Arabic we say الأقراص الفوارة. Tablets, toothpaste, aspirins, caplet, and capsule. So, moving to the materials in the hospital. A medical device is any device intended to be used for medical purposes. Medical devices benefit patients by helping healthcare providers diagnose and treat patients and helping patients overcome sickness or diseases, improving their quality of life. Here, materials used in the hospital are all the instruments used to make the health of the patient well. So, here is a pyramid, of the medical devices classified on the class of dangerous. So, as you have seen here, we have an arrow from the high risk till the low risk. We have class 1 and class 2A, class 2B, and class 3. The items are classified on the degree of dangerous or the risk. We have here the class 1, low risk level, thermometers, tongue depressors. Class 2A, low to moderate risk level, hypodermic needles. Class 2B, moderate to high risk level, lung ventilators and bone fixation plate. Class 3, high risk level, heart valve, and implantable defibrillators. So, here is some names of materials. We have anesthesia machines, surgical lights, surgical tables and chairs, monitors, defibrillators, electrosurgical, stretchers, microscopes, infusion pump, stainless medical equipment and imaging, respiratory ventilators, sterilizing, AKG machines, endoscopy systems. So here we arrived to the end of the second course. Hope that you are benefit from this course. See you in the next course, inshallah.